a city of 11 million people with almost no one on the streets. Trains, planes, buses, cars, almost nothing leaves or enters Wuhan. Hospitals in the epicenter of the outbreak are overwhelmed with patients. So overwhelmed that authorities have now decided to build a new, dedicated hospital from scratch. They're hoping to complete construction in just 6 days. In existing hospitals, health workers are working tirelessly against the virus.
Of course we're worried, and so are our relatives. But we're nurses and we'll do our job as long as we wear the uniform.
Despite the rising number of cases, the World Health Organization has refrained from declaring a global health emergency.
And the question was whether this event constitutes a public health emergency of international concern. The advice to the DG, which is provided by the emergency committee, is that now is not the time.
But China isn't taking any chances. Transport links within and to a number of nearby cities have been cut, and the fear of contagion has produced dramatic scenes, like here at Fuzhou Airport, where a man suspected of carrying the virus was confined to a quarantine container. The lockdown now covers more than 30 million people, and it's putting a serious damper on their Lunar New Year holiday.
So Chinese authorities are taking strict measures to contain this virus, but do they believe they're getting it under control? Here's more from our correspondent, Fabian Kretschmer, in Beijing.
If you watch the official news in the evening on the state TV, then they acknowledge, yes, it's a severe crisis, but it's under control. And on social media, there's really another picture, because people are sharing massively short videos from Wuhan, from the epicenter of the virus, of overcrowded hospitals that have to reject patients. Also hospitals that have to install temporary tents outside their buildings because they cannot cope with the demand and also the needs of all the patients. So it really depends also on what kind of information you're accessing, whether you're really worried. The young people who share information on social media, they are deeply worried. They all wear face masks. While the older generation is somewhat, also concerned, but less than the youth, and they are more also in a festive mood, because right now there's also the Lunar New Year, and actually it's supposed to be a celebration.
Let's get some more analysis on the story now. We can speak to Posse Penton. He's the head of the European Center for Disease Prevention and Control in Stockholm. Posse, thank you for joining us. As we saw there, China is expanding its lockdown, including more cities. Is this an effective way to contain the virus, or is it coming too late?
Well, these are very drastic measures that the Chinese authorities have decided to take in response to this relatively large and rapidly evolving outbreak that they have on their hands. These are measures that could not be done in European contexts. And they are taken with great expense to the local and Chinese governments, as well as the economy in general in these cities. This is very much done to minimize the possibility of infectious individuals appearing in other cities in China, but also in other cities globally. So the Chinese authorities are taking these measures very much to protect the global community.
Posse, what makes this virus so serious? I mean, how does it compare to regular winter flu outbreaks, for example?
So first of all, this virus has evolved and appeared at the worst possible time in Wuhan, but also in the worst possible time for us in Europe, since we are in the middle of this season's influenza outbreak. It is likely that in Wuhan, for example, a large portion of those people that you report on trying to get care in the healthcare system are actually influenza cases, but you do need to have a laboratory diagnosis to differentiate between the two. The virus that we're talking about now, the novel coronavirus, we have very, very limited data to base our risk assessments on. We have published that on our website a couple of days ago. But from what we understand so far, this virus is very similar, both genetically as in its behavior, to the 2003 SARS virus. which caused globally important outbreak, before all in healthcare systems. More than 8,000 cases at the time, with a 10% mortality rate, so about 700 cases dying in different locations around the world. We, the national public health authorities globally, are all preparing the healthcare systems to face these issues.
Posse, you mentioned the SARS outbreak. I mean, what has been learned from that? What do we know now about effectively containing this type of virus?
Well, first of all, we know that it is very important to detect infectious cases as early as possible. That needs awareness and immediate action from the whole healthcare system in those countries where these cases can potentially be detected. And at this stage, these are the countries in the world. We have not seen transmission outside imported cases from Wuhan city in other countries outside of China. And I'm sorry, we haven't seen transmission in countries outside of China, but only exported cases from the city of Wuhan. But it is likely that we'll also see cases in Europe in the coming week as people are traveling away from.
Okay, we'll have to leave it there. Posse Penton, head of the European Center for Disease Prevention and Control in Stockholm. Thank you for joining us here on DW.